The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So to your point earlier, we want to know, okay, have your personal preferences changed? What are the reasons? If we're removing them, are we okay with not having that volume there? Do we want to consider restoring it with maybe a fat transfer if that's an option? Maybe putting in a different implant if we still want to maintain more significant volume. So it's understanding what look the patient wants, their reasoning for what they're doing. And then we basically are looking at the skin envelope, and also how we're going to volume restore. So when I completely remove implants, because patients don't want them anymore, I'm almost always doing a lift at the same time because the skin's been stretched out at that point by the implants. We want to get everything like higher, tighter, more compact. And then assuming the patient doesn't have just skin left, if they have some residual breast tissue, then we can also do some fat transfer. And some patients like that because you're not going to get as much volume as if you have an implant, and it's certainly not as much guaranteed volume as if you choose an implant, but it can restore some of that because it can be shocking for some patients after removal if their breast tissue is essentially all gone and they don't really have much breast left. How do you like to counsel patients, and what are you considering?
I mean, that's exactly what I say. I do have some additives for patients who want to go larger. Yes, we could take out your implants and go larger. How large sort of depends on your anatomy. If it's a little too large, even though your skin has already been stretched out, we may have sort of a ceiling as to how large it can be. The flip side, of course, is exchanging the smaller implants, because if you go a little smaller, I do think that it depends on the patient, their skin laxity. They can just get an exchange. But if they go substantially smaller or they have more loose skin than they realize, they will need a breast lift at the same time as getting smaller implants. And finally, with fat grafting, it's very cool that we can actually smooth out the contours. We can deliver fat anywhere we want in the breast. So not just with a breast implant, which has a very defined shape. You can't change the shape. With fat grafting, we can actually slightly alter the shape and contour of the breast implants because we can put that fat anywhere. But we are limited to, my guess is about 300 cc's, which seems to be sort of a hard limit for many plastic surgeons as to how much fat you can actually add. And in the US, at least, 300 cc's is not that big of an implant. We typically put in larger ones.
And then of that fat that's transferred, we know not all of it's going to survive. So depending on what you read, it's, at 50, 60%, that is probably a good 70% would be great of what you get to survive the transfer. And it's going to depend on also, we need a good field to sow the fat grafting seeds. So if you don't have enough breast tissue to begin with, you're not going to be able to put 300 cc's of fat transfer in there. Or you might need to do multiple rounds of it if that's something you want to do.
That's absolutely
the
correct.
Final option always is just simple removal, but that one I spend a lot of time talking to patients about what that's going to look like. If they've got salient implants, we can actually deflate them in the office just by poking a hole in it with a needle after we numb the skin. So that allows patients to kind of see what their breasts would look like and allows the skin to retract as much as it's going to. Some women may be fine with that. They're not too concerned about it, or maybe they didn't have really big implants in to begin with and good skin quality. Other women will see, oh my goodness, that's what I look like without, I've forgotten, that's what I look like without breast implants. And then they may be inclined to put a smaller one back in or have a lift or some combination of procedures. And so there's always other things that you can do afterwards if you remove your implants and you're not thrilled with how that looks without doing any other procedures.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.